These are in listen-only mode.
Welcome to Part 2 of Gambling 101, covering the basics, brought to you by the New Jersey Council on Compulsive Gambling. My name is Dan Trolero, Assistant Executive Director. Today we're going to cover the second part of our two-part series. Some of our objectives include discussing dual addiction with gambling and substance abuse, covering a basic overview of the various gambling screens, basics of treatment and recovery options, and guidelines for responsible gaming or gambling that exist, and just some rules to follow and some, as I mentioned, some guidelines to keep it safe, fun, and a form of entertainment. Again, the Council on Compulsive Gambling is neutral as it pertains to gambling. We're neither for nor against gambling. Rather, we want to provide support, treatment, and hope to those struggling with the addiction of gambling, to the loved ones and family members, or to those struggling with addiction to gambling and substance use disorder. We also recognize that mental health issues are also a part of addiction and have to be addressed and treated. That is something that will be covered a little bit later on. We provide the support, treatment, and hope to those who call 800-GAMBLER and also those who visit our website at www.800gambler.org. We do have the ability live chat, and again, our helpline 1-800-GAMBLER. In our last session, we talked about disordered gambling, and just to recap, what is disordered gambling? We identified it as a maladaptive pattern of wagering and behavior, and it does continue despite multiple attempts to control or stop. We recognize that gambling continues. We realize it might be wrong for us. We should try to stop. It's creating problems within our lives in the form of financial or relationships, social, psychological, yet it continues, because addiction will quite simply continue until we have that willingness and that desire to start looking for a better way of living. So despite those negative consequences, we continue to take our drug of choice. And with gambling, how it is a little bit different from substance use disorder, there's nothing being ingested. The disordered gambler is not putting anything in his or her body. They are addicted to the process, the activity, the action, the escape. They're not ingesting a substance, so it's hidden. It's not easily seen. It's typically identified through behavioral or emotional signs. There are some physical manifestations. We will talk about some of those, but for the most part, it is considered a hidden addiction. The most recent revision of DSM-5 moved it from an impulse control disorder to substance-related and addictive disorder. We are no longer using the word illness or disease. It is a disorder. And that acknowledges the correlation between the social, the biological, the cultural, and psychological factors. And gambling is the only behavioral disorder. So that was the 5th edition of DSM-5. The new term being disordered gambling, classified as addiction and related, it is a separate category under behavioral addiction. One of the main criteria that was eliminated was the concept of committing an illegal act. Right now, that is no longer considered mandatory or a criteria to make gambling qualify under DSM-5. Committing an illegal act does not always mean that you have the disorder. In other words, if I did not commit an illegal act, that means I must not have a gambling disorder. That thinking was thrown out the window. So that was removed as a criteria. This is also the first time we have an addiction without the ingestion of a substance. Within the appendix of DSM-5, there is a review for pornography or sex addiction and internet addiction, but gambling was the first one to make it. And there is a severity continuum, with 4 to 5 being mild, 6 to 7 being moderate, or 8 to 9 being severe. Some of the implications of these changes, it gives medical legitimacy to gambling disorder. It may be important for future funding and insurance coverage. It is presently not covered under the ADA, so that is something that will be reviewed and further thought of in the coming years as well. Also, gambling, with the DSM-5 change, it does affect the primary and secondary prevention efforts. And we do see a little bit more diagnosed early on. We don't see it as much in treatment. However, with DSM-5 now placing gambling disorder and elevating that more towards an even and level playing field with substance use disorder, we are hoping and advocating for more opportunities for treatment. One of the areas within the state of New Jersey that we provide coverage for is that we do 30-hour trainings for individuals looking to gain more knowledge, more experience, more education and awareness as it pertains to disordered gambling. The thinking is that the individual can then go on to take a test, a national test, and receive supervisory hours and clinical hours should they choose to go for their certification as a gambling counselor. So that is something we do hope to see more of around the state of New Jersey, and we do have quite a turnout for each and every one of our 30-hour training sessions around the state of New Jersey, which are always free. 2014, SAMHSA reported that 7 to 10 million people in the United States have co-occurring mental and alcohol or drug use disorder. And what's very clear from this, and what we know from experience, is that people are less likely to recover from addiction when their co-occurring illness is left untreated. As I mentioned in the prior webinar, it is important to treat the whole body of work, treat the entire person if we're going to get somebody well, the concept of wellness, if we're going to help somebody recover, if we're going to help reduce the amount of flare-ups, that someone has in their recovery. Just important to look at the entire body of work, taking into consideration childhood trauma and all of the implications of life, relationships, social status, surrounding, cultural, etc. Among co-occurring disorders, we have to think about substance-related abuse or disorders. We have to think about bipolar, depressive, kleptomania, antisocial, narcissistic, and obsessive-compulsive. So these are just various co-occurring disorders that could become evident as we're dealing with someone with substance use or a process addiction like gambling. So gambling and substance abuse do share many of the same characteristics. Those similarities include preoccupation, escape, the intense cravings, a tolerance, the inability to stop even though things are going bad, and withdrawal. These are all very similar, whether you're talking process addiction or substance type addiction. And those similarities are not unique to any one drug, but rather similar across the board. However, there are differences between addictions. There are differences between substance and problem gambling. First being that substance addiction is a drug-seeking behavior, a physical drug-seeking behavior to ingest to get a high. We do recognize that the excitement level does build as the person is seeking the drug. However, ingesting the drug, whether it's shooting heroin, consuming alcohol, cocaine, or crack, the ingestion of the drug will then change the brain chemistry and change the person's, that's a mood-altering substance. With respect to gambling, the concept of chasing losses. The gambler has lost the money at the casino or on the internet, and they're now going back for more, chasing losses. They're not gaining anything. They're chasing what they've lost. So instead of picking up and gaining, they're chasing a loss. It's the action, the excitement. It could be continued escape from life's troubles. So that's the gambling addiction, Nate. Substance addiction, there are visible physical signs of addiction, as you can see. Whereas a gambling addiction, there's no visible outward physical signs. What I will say is we have come across situations within the state, as we speak around the state, people referencing the fact that due to the stress that the lying and the cheating and the gambling and whatever else was going on, that maybe they would develop shingles at an earlier age. They would have hypertension. They would have heart issues. There were other signs that perhaps you could see. Loss of weight is another one, but that's not unique to gambling. That could be addiction across the board. So gambling can have some subtle physical signs. However, there's no dramatic physical signs as we see in the images of substance addiction. Another difference, substance addiction, the addict would be enabled by the family, whereas in the gambling addiction, the family is bailing out the problem gambler. Money oftentimes is a big difference between the gambling addict and the one with substance use disorder. The person with gambling disorder often comes to treatment, comes to their bottom with tremendous amount of financial debts, and they're looking for bailout. They're looking for money. They still think it's a money problem. and they're thinking if they just had a little bit of money, they wouldn't have a gambling problem. But what we know is that it has nothing to do or very little to do with the money, and instead it has everything to do with it being an emotional problem, the behaviors that are associated, the character changes that need to be made as well. So gambling addiction, typically the family will bail out the problem gambler with money. Substance addiction, the family will make excuses for the one with substance use disorder. Substance addiction, there may be some financial problems, whereas with gambling addiction, as I mentioned earlier, typically very big financial problems. Within substance addiction, drug tests and breathalyzers can confirm suspected use. You can give a urine sample, breathalyzer, etc. However, with gambling addiction, it's hidden. It's a hidden addiction. We cannot test for playing dice. We cannot test for cards. It's not in our system. It's not in our bloodstream. It's not on our breath. So typically, problem gambling can be a hidden addiction until the money runs out. With substance addiction, death is often unintentional. Could be an overdose. However, with gambling, as I mentioned in the first session, the suicide rate for problem gamblers and disorder gamblers is actually 1 in 5 attempted suicide. So higher suicide ideation and attempts for those struggling with gambling disorder. For substance addiction, another difference, once in recovery, the person with substance use disorder may be able to avoid problem substances or might be able to, in order to reduce temptation for relapse or for a flare-up, if you will. However, for gambling addiction, once in recovery, we need money on a daily basis. The gambler has to be very mindful to give the control of the finances over to a loved one or a family member. Perhaps a budget should be in order and used and leveraged. There should be an allowance given to the gambler so that he or she is held accountable for the decisions they're making as it pertains to the use of funds. Oftentimes, if there's a dollar in the gambler's pocket, that could be a temptation to go back and gamble. So it's often very tricky for a gambler in recovery because constantly a dollar in the pocket can buy a lottery ticket. And it's something that's constantly on their mind. Walking to a convenience store, the nearby 7-Eleven, the Wawa, there could be lottery machines unattended or not really closely watched, and a person could go and quickly buy a ticket. So it's constantly a daily struggle, as most addicts in recovery find from any drug of choice. But there are serious potential consequences common to all addictions. First, mental and emotional problems. We have permanent changes in the brain. We have depression, anxiety, or paranoia. There could be school problems for adolescents or teens, college kids. It could be poor grades, getting kicked off a sports team, or dropping out of school. We could see problems with the law, truancy, a permanent record perhaps. Employment problems, perhaps someone will lose their job. Maybe not living up to the expectations, hopes, or dreams that they had set up for themselves, so diminished life achievement. Problems in daily living exist. Could be money problems, could be homelessness. We could have problems with family and friends. Again, these are all common elements, similarities of substance use disorder and gambling disorder. You can have a loss or change of friends. There could be family problems, dysfunction. Children could argue. Problems with coping, losing time, self-harm, or inability to protect oneself from external harm. We know addiction gets progressively worse over time, could lead to health problems or other progressive diseases. We do understand that recovery can be painful, difficult, and costly. We understand that recovery is not a smooth road. We'll never be cured of the addiction. Flare-ups are common, and I use the term flare-ups just very mindfully because the term relapse is sometimes taken in a negative connotation. However, if we have a disease and if we have a flare-up of our disease, the person is feeling just a little bit better about the sense of the recovery process. And sometimes a flare-up does occur. And we have to always be mindful that addiction is a disease. It's an illness. And flare-ups happen. So when I talk about flare-up, I am also referring synonymously to the term relapse. Some we know never make it back, premature death or suicide, whether from overdose or suicide. So those are the commonalities. When we talk about screening, we need to talk about having the client come in for treatment, and the first step is always to screen. And that involves a thorough intake, an assessment, assessing the presenting complaint, taking a look at the social history, the life stresses, medical, financial, any psychotic disorders, trauma, and substance-related issues. We need to look at the whole body of work, as I've mentioned previously. When we talk about screening, we talk about various gambling screens, and there are several. And the first one, very common, is the 20 Questions of Gamblers Anonymous. That can be found on the Gamblers Anonymous website, on our website at www.800gambler.org as well. And typically, if the person taking the test answers yes to 7 or more of the 20 questions, it is recommended that they attend a Gamblers Anonymous meeting because they might be at risk or have a problem with gambling in their lives. Other gambling screens include the LiveBet 2-question test, the SAMHSA Biosocial gambling screen, a 3-question test, South Oaks comprehensive gambling screen, and also the DSM-5 addictive gambling criteria. A couple of the questions for some of the tests that is selected. The LiveBet questionnaire, I like the LiveBet. It's quick, it's simple, and the questions are, have you ever lied to the people important to you about how much you gambled? Note that you're talking about people that are important to you, not just the mailman or the garbage man or someone that really doesn't know you very well or doesn't really have your best interests in mind. And number 2, have you ever felt the need to bet more and more money? So this question is asking about the lying aspect and the betting aspect, which is the chasing end. The brief biosocial screen, during the last 12 months, have you become restless, irritable, or anxious when trying to stop or cut down on your gambling? In the same token, have you tried to keep your family or friends from knowing how much you gambled? So that's the hidden nature. And did you have such financial troubles that you had to get help from family or friends? When we talk about another screen, the New Jersey SAMs, have you ever spent a lot of time thinking about your gambling experiences or planning future gambling ventures? Have you ever lied? There's the lying question. And after losing, do you look to return as quickly as possible? It should be noted for all gambling screens, I think it's important to really clarify what gambling is. I think it's important to direct the client to indicate that for the next few questions, gambling is defined as, and that's where we identify and we lock them into a way of thinking. Gambling is defined as playing horses, playing cards, shooting dice, scratch-off tickets. Tell them what gambling is, because what we find is that some people, some clients, when they're coming for a presenting complaint of, say, substance use disorder, they may not think twice about gambling as being an issue, and they may have a hard time accurately identifying what forms of gambling are. And if you ask someone a generic question, do you gamble? They might just say no, because it's such a large question, a nebulous question, hard to wrap your head around. But if you ask someone specific questions, do you do scratch-offs? Do you play New Jersey Lottery? Do you play blackjack? Do you play poker? These are very specific questions. Sometimes we need to guide the questioning very specifically. South Oak screen is comprehensive. Usually it's completed if one of the preliminary screens that I just referenced yields a positive result. This is based on former DSM-3 criteria. It can be self-administered, but typically given by a clinician, and it is internationally used. Once we have a client visiting with a counselor on a regular basis, we have to realize the advantages of certified counseling. Certified counselors, whether dealing with substance use or gambling, they can interrupt family patterns. They can enrich an experience in GA or NA or AA. They can kind of enrich that 12-step recovery model by talking about what the individual learned that particular week or day. A counselor can offer hope that change is possible. Offering hope is huge. Our motto at 800 Gambler at the council here is support, treatment, and hope. And it's always important to offer hope to someone that change is possible. We also know that psychotherapy offers a safe place. You have the knowledge and training of a therapist, specialized intensive treatments, and in some cases, drugs or other therapies can be made available under the proper certifications, licenses, etc. When we talk about recovery and treatment, we must talk about the 12-step recovery groups, the fellowships, the peer support, and GA, Gamblers Anonymous, as well as GAM-Anon. So the 5 benefits of Gamblers Anonymous include the identification, that I identify myself as the person, and as the person next to me sits there, they can identify, and we can feel comfortable sitting next to each other, being able to identify the issues that each one of us are going through. Acceptance, the fact that I accept what I have done, I accept that I have this illness, this disease, and that I do want to work to get better. Third concept is pressure relief. This is unique to the GA Fellowship. Pressure relief will help the problem gambler or the disordered gambler outline his or her expenses, his or her incomes, and who that individual owes money to. And through the group, they'll start working on a repayment plan to repay those debts, to help alleviate or remove some of the pressures felt by the gambler in early recovery. Remember, the gambler in early recovery may still be thinking that this is a money problem, and they're coming to GA for maybe a loan, maybe to figure out how to pay people off, not really for the reasons of recovery or to accept the fact that they have a gambling issue. The 12-step philosophy allows for continued lifetime progressive character changes, and it allows you to work steps in order, deeply, move through a process to help understand, perhaps for some, why they did what they did, although some will never understand. Some will identify character flaws or weaknesses and try to work on those. Some will look to give back. But the first key, it's always so important and vital in any room, is to walk in the room. That's the first key. Get in the room and realize that you can't do it by yourself and that you do have a problem. Lastly, one of the benefits of Gamblers Anonymous is the concept of peer support. Having a sponsor, having a support system, a support staff is just vital for any recovery. We know addiction can be an isolating activity. We know recovery has to have peer support involved. Benefits of GAM-Anon. Well, the GAM-Anon is for the friends and family members, much like Al-Anon and Nar-Anon, and they're basically in so much need as the gambler in recovery, because the family members are taught very early that they did not cause the issue, they can't control the issue, and they can't cure the issue. And for all of the lying and the cheating and the mistrust and the distrust that they've had to put up with, and the abuse, whether social, physical, psychological, emotional, GAM-Anon members need a safe place as well. And they, much like the GA members, can identify and can accept and can gain so much knowledge and insight and camaraderie from their peers around them. When we talk about treatment, as I've mentioned, we treat the whole person, but we also have to know when to refer out if necessary, using good techniques of counseling and open-ended questions. It's important to always keep in mind doing no harm, motivational interviewing, meeting clients where they are. I think it's very important. If we have a client who does not see their issue as a problem and we're giving them strategies on how to fix it, we're not meeting the client where they are. You know, you cannot meet someone in pre-contemplation stage by talking about an action plan. And so motivational interviewing will recognize and accept that fact, and we need to work with the client. We can also leverage cognitive therapy, stages of change, harm reduction, and then through treatment and leverage the benefits of the 12-step GA and GAM-Anon for the friends and family members. One tool or another tool that is used in treatment is the encouragement of self-exclusion. This allows the gambler to exclude themselves from in-person land-based casino gambling or internet online gambling. Information on self-exclusion can be found on the Division of Gaming Enforcement's website, the New Jersey DGE, as well as on www.800gambler.org. A couple of notes on self-exclusion. The person on the self-excluded list is prohibited from collecting any winnings. They are requesting to be banned from all legalized gaming activities and marketing promotions. They will not be able to recover any losses or accept any complimentary gifts or promotions. And they can have their own name placed on this list, either online or in person, by submitting that. We do talk about gambling. In the last section here, I want to talk about responsible gambling and responsible gaming, because we do realize that from the earlier presentation that roughly 90% of people can gamble as a form of entertainment and as a form of social responsibility. So what is responsible gaming? Because I think it's important that we do talk about the concept of being responsible. And there's a quote that I like out of Jamaica from a company called Rise Services. And responsible gaming is a shared responsibility with collective action by the gaming industry, government, individuals, and communities. The aim is to achieve outcomes that are socially responsible and responsive to community concerns. The principles that govern responsible gaming are grounded in science and driven by collaboration. Collaboration, that last phrase, grounded in science and driven by collaboration, is key. It helps the stakeholders realize that they all have a part on responsible gaming. So elements of responsible gaming here at the Council on Compulsive Gambling of New Jersey include harm reduction and measures for prevention, proper training of staff, that can be casino operators, those can be customer service providers, provisions for data research, whether they're surveys that are on our website or whether we're partnering with other agencies conducting research on substance use disorder. We always try to include gambling. We want to understand how it connects, correlates, and joins with the other issues at hand. Displaying brochures with guidelines for responsible gambling. That occurs on the casino floor. Many of the casino operators in New Jersey will have brochures or literature or a way to reach out to either our number or to share ideas and thoughts on responsible gambling. There should be information about odds of winning and losing. The internet with online gambling currently has responsible gambling guidelines embedded within the computer systems, which will time people out or have a cooling off period for people who are maybe gambling a little bit longer, which could mean that they do have a problem. And also training programs. Every year in March, we conduct training programs for employees of the casino operators about problem gambling, responsible gambling, because it is important to learn how to deal with both the problem gambler as well as the relatives of the problem gambler. So some basic guidelines that we share when we go around the state. Communicating responsible gaming is number one, setting limits and sticking to them, deciding how much time how much money and how much time, and then stick within those limits. It's important to know that you're going to lose more than you win, so make sure you're playing with money you can afford to lose. Making informed decisions about your gambling and knowing the odds. Thinking of gambling as a form of entertainment is important, not a way to make money. And if somebody wins big, they should enjoy it, but they should also realize and have mindfulness to know that it may never happen again. Additionally, we encourage people to never gamble when they are tired, bored, anxious, or angry. That's a way of escaping some feelings, and we'd rather not have you gamble when you're feeling that way. Keep track of time and money. Take family and friends seriously. If they are worried about your gambling, they might be seeing something you don't see. Only use your own money to gamble. Don't borrow from other people. Don't borrow from people you don't know either. And realize that in most forms of gambling, you have no control over the outcome. It's random. There's misperception, especially amongst early gamblers in their 20s, that if they wear a certain shirt, sit at a certain table, or wear certain jewelry, or blow on the dice, that they can affect the outcome. And we just know that just doesn't. That's just never the case. Other responsible gambling guidelines: take breaks, walk around, slow down the action, slow down the pace. Keep your head clear. Don't drink excessively when you're gambling or use drugs. Balance the gambling with other leisure activities. It's important that if you're spending a day down at a casino, to not only just gamble the whole time, but take in a show, take in the nightlife, perhaps the sights, the boardwalks, the ocean, the pool area. Make it an overall experience. It's always good to go gambling with someone who does not have a problem with gambling so they can help be a checkpoint for you. Don't chase your losses, and leave your credit cards and bank cards home. Don't take them when you gamble. And lastly, setting limits, as I mentioned, making your own decisions, not using gambling to avoid negative feelings, not gambling with money set aside to pay expenses. Again, realizing it's a form of entertainment and accepting your losses as the cost of that entertainment. And if you are concerned about your gambling, talk to someone you trust. And that someone could be 1-800-GAMBLER. Give us a call. We're here 24 hours a day, 7 days a week. All calls are confidential. We'll point you in the right direction. We'll tell you where the local GA meeting is. We'll give you the name of a certified counselor and inpatient facility as well. And if you have other questions or concerns, we're happy to talk with you. until you feel comfortable. We'll point you to our website where you can get additional literature and information, and we just want to provide the support, treatment, and hope that the gambler or the loved one of the problem gambler is dealing with. So I thank you for your time. Hope you have found this helpful and useful, and we look forward to being of service in the days, weeks, and months to come. Thank you.